Rotation,
exactly,
motion, palpation.
motion, palpation of the cervical spine. And so the first thing to take note of is that the headrest of the table is positioned in a neutral or slightly flexed position. So one thing that we don't want to see is a patient that's positioned in cervical extension. Again, that compresses and approximates the cervical facet joints, increasing the likelihood of irritation, especially for our patients who have mechanical neck pain, which is the reason why a lot of them are lying down in the first place. So from here, it's good to have the patient's head centered on the headrest. So in this case, I'd say please slide down a few inches towards your feet, and we'll go just a little bit more. Perfect. And let's say that we'd like to assess for a left rotation restriction. So first, we need to do the opposite direction in lateral flexion. So right lateral flexion goes with left rotation. We use our lateral index contact, so the proximal phalanx of the index finger, and that's going to be pressed into the articular pillar formed by the facet joint articulations in each segment. So this articular pillar is our contact point for our motion palpation and our manipulations in cervical rotation. So from here, starting at C1, we can laterally flex, again, away from the side that we're checking in rotation, so that's to the right, and now we can rotate to the left. And what we're looking for here is to find that end range barrier and to give a gentle push into that barrier, or more of a nudge, to try and assess the quality of motion at that end range. Does it feel relatively elastic? Does it feel giving and then returning to its normal level of resistance? Or does it feel like there's a blocky, firm resistance that doesn't budge when you push into it? And that's going to be the classic sense of a restriction. Additionally, for these movements that are bilateral, like rotation, we want to compare the quantity of motion, the relative amount from side to side. So do we have a relatively similar amount of cervical rotation at the same segment going left and then right? So we can go all the way down the neck. For the purposes of the exam, you'll be asked to assess just one segment. So it would be, please assess for a C2 left rotation restriction, in which case we would find C2, right lateral flex, and then left rotate. And then into that end range barrier, giving a gentle nudge. And then I'll ask you for your opinion. Do you feel that there's a restriction there? This isn't going to be a live and die answer that is, a huge deal if you haven't found a restriction that's there, or if you feel that there's a restriction there's not. But it's a good opportunity to start really paying attention to what you feel. So we've talked a little bit about that, and you'll get a chance to now state an opinion now that you have